Senator Daly, 3 minutes.
Thank the Minister for coming into the House and making time in relation to this issue. And Mark Twain spoke about the statistics being pliable and the facts being stubborn. And I mean, the facts are that the A&E situation is a disaster. And I know the Minister said that we were resorting to personal attacks. What we are doing as an opposition is doing our job. We're pointing out where the system is failing. This is not being personal with the Minister, but we're asking the Minister to do his job. We're not asking him to be the commentator-in-chief or an apologist for the HSE, which seems to be the role he has assumed, and that was pointed out in the late debate, where all 4 commentators of all hues, and media people as well, said, if one person pointed out that if only he was a TD and a member of the Cabinet, maybe he'd be able to fix the system. But we are asking you to be the Minister for Health. We're not saying that what you're doing in your capacity as the Minister is good enough. We are thinking that you should do more and do better, and you are not the victim. The people who are the victims are those in the trolleys. This is not a personal attack against you. But we don't want you to be the victim-in-chief either. We want you to fix the system. The people who are the victims are on the trolleys. They're the ones who are waiting for the emergency ambulances, which a HSE report pointed out that because Ireland's such a rural country, that it's just acceptable that the ambulances won't get there in time. I mean, I know that in Kerry. Senator Maloney knows that every month there's a story about an ambulance not arriving in time. And that's just in Kerry. It happened in Roscommon. It's happening every day of the week. The ambulances aren't showing up. Never mind trying to get them to the A&E. Sometimes they show up too late. And they're the victims. So this is not a personal attack. Our job is to be the opposition, to highlight what is going wrong in the system and to look for solutions. We're not the ones that can make the solutions happen. The Minister is the one. But it's the A&E departments are not working. January is coming. We all know what happens in January. But what is also happening is the HSE are hiding the problem. Just imagine when you visited Lourdes Hospital that they moved beds off the A&E and out of the A&E into the wards to hide them and then moved them all back in when you were gone. Now, any government that has their own HSE, their own health service, hiding beds when the Minister arrives, it's straight out of Westminster. It's straight out of that. But it's actually happening. That's the sad reality of it. That not only are they hiding the facts, they're actually hiding the patients when you go to visit the hospital. I'm sure that they had a hell of a job done out in Tala if you were to visit. I'm sure there was a great job done. And everyone was put into broom closets and hidden away. But if we went back, it happened in Drogheda, the victims are the people on the trolleys.
Thank you, Senator.
Thank you.
Call the Minister to respond. Thank you.
Couple of comments. I apologise, Senator Byrne, for making a short speech, but sometimes it's actually possible to say what you want to say and do it concisely without having to repeat the exact same things at length ad nauseum all the time, as if that were ever to achieve anything. And I don't think that solutions are actually made in long speeches or commentary or analysis, and that's why my job is to be in HCHQ where I was today, in my department where I was yesterday, and on the ground in places like Tala where I had intended to be this afternoon, and I'm sure that can be rescheduled and will be. I accept that it is of course the duty of the opposition to put pressure on me as Minister to do my job, and I accept that, but you also have a duty to proffer solutions, and I have to say I didn't hear one in this entire debate, for at least from the Fianna Fáil members, which says a lot, I think, in its own right. I think Senator Maloney is correct. The overcrowding in emergency departments is caused by a number of factors, most of which are outside the emergency department. We do know that. But it's certainly not a simple function of bed capacity. If it were a case of more beds, we would have had the problems in Drogheda long solved by now, because there are 24 additional nursing home beds and 12 out of 24 open beds in the hospital. And there are other issues. There are issues as to how beds are used. A hospital with an average length of stay of 8 needs twice as many beds as a hospital with an average length of stay of 4. It doesn't get any more work done, though. It just does it slowly. And the same, of course, applies to admission rates. In some hospitals, about 25% of patients who attend the ED are admitted. In others, it's 50%. So that hospital needs twice as many beds because it admits twice as many patients. But why does it? And there's all sorts of reasons for that. And I'd love to be able to personally manage every hospital in the country. I can't. What I can do is set policy directions as to how things should be done and try to fund them. Just on the whole issue of the American nurse, I can check that out. But as I understand it, American nurse training is different. It's not equivalent to ours. Our nurses are BScs, whereas I think American nurses are still trained in the old way. And I don't think that their qualifications are equivalent to ours. And that's why that is, and I'm sure that applies to other professions too. But GPs often do have direct access to X-ray, not every day, but it's available in most cases. And certainly down the Western Seaboard now we have a pilot giving all GPs access to an ultrasound within 5 days, or if it's urgent, 10 days if it's not, and expanding access to diagnostics for GPs over the next number of years, I think is part of the solution. Senator Barrett mentioned spending. I think it's important we always compare like with like in these things. A lot of what we do in Ireland, for example, social care for older people, which is part of the health service, is done by local authorities in Britain. So you do have to compare like with like, and our spend includes both public and private spend, and the private spend probably isn't spent in the same way as it would be if it were spent by the state. But that said, I've no doubt that we're not an outlier in terms of spending. We're somewhere in the middle, and we don't get the value for money we should. I'd just like to mention, I know we've corresponded on Baggot Street Hospital. I was there on Tuesday night to check out some of the sexual health services that are there. I can confirm that there are no inpatients in Baggot Street Hospital. There are no beds there, and haven't been for 25 years. It's used now for as a day facility for a number of things. So we're not losing any beds there. I want to thank Senator Crockwell, particularly for his very measured comments. And as you say, it is of course an issue that has plagued us for a very long time and does occur in all countries in all different ways. But it is one that I do want to do the best that I can to alleviate as best I can. And there is variability in terms of implementation and cooperation from site to site, and that is very true. On the ambulance response times, for depending on whether it's an echo call or a delta call, the target is 80% or 60%. They haven't been invented in Ireland because we're a particularly rural country. They're actually taken from other jurisdictions, and it is accepted, not just in Ireland but worldwide, that it does take an ambulance longer to get to a remote location, and it always will. And no matter how many ambulances you have or who is Minister of Health, that will always be the case. The ambulance will not always get there on time. That is the truth of real life. And you know, if you think that's going to change by changing government or changing minister, you're mistaken in that regard. But what we are doing is increasing resources for the ambulance service. It wasn't cut back during the recession. In fact, better than that, it was increased. An air ambulance was provided that never existed before. There was a €5 million increase in budget last year, and there will be a €5 million increase in the budget next year as well. And in relation to Our Lady of Lourdes, you may not be aware of this, but I did actually visit twice. I visited once on the way home from the funeral of the guard who was murdered. From the motorway, rang the reception to tell them I would be there in 20 minutes. So I don't know how many patients they managed to move in 20 minutes, but probably not that many, particularly not in a crowded hospital like the Lourdes. I did visit officially a second time. And I regularly visit hospitals at short notice, actually, and I can do that because I know a lot of people who work there and I can walk in there. I visited at short no notice in Connolly Hospital in Blanchardstown, in St James's, in the Mater, in Tala at 8 o'clock at night, and at Vincent's, and I'll do it again. And the reality is, and if you ever have the opportunity to be a minister, you'll know this, and it doesn't just apply to ministers. Any time there's a ministerial visit or an important person or a VIP or whatever visits anywhere, there are some people who will want to put their best foot forward and make things look as good as they possibly are. The reverse happens too, by the way. And at a meeting that I had with a union meeting that I had with a nurse, a particular nurse admitted to actually moving a patient out of a cubicle onto a corridor, so I would see what it was like on a bad day. So these things happen both ways, and when people know the minister is coming, they'll organise protests and they'll confront you with issues that mightn't actually be there in the day. I didn't come down the last shower. I'm not that stupid. And that's why I make visits at no notice, short notice, as well as planned ones.